story by Emily Chebet, of course, leads us to our discussion here. Like we've said, for the better part of this year, 96 days, I believe, the UHC workers have been out on the streets clamoring for better pay conditions. With me tonight, Dr. Uma Oluga, who is the Principal Secretary, Medical Services in the Ministry of Health. Mudhomi Njuki is the Governor for Tharaka Nithi, but also the Chair of the Health Committee in the Council of Governors. Gentlemen, thank you for joining us on The Explainer tonight. Let's start with you, Dr. Oluga, perhaps from government. Let's understand the genesis of the question of UHC workers. It's been over 5 years. Take us through how this all began.
Thank you, Yvonne, for this opportunity to explain the issues around UHC. First and foremost, I would like to say that this is my first TV appearance since
as PS.
I was graciously and given this opportunity by His Excellency the President, that I would like to thank so much. And secondly, I would like to thank Governor Mudhomi Njuki and the Council of Governors, because we've worked very closely with the Council of Governors in trying to find an amicable solution to the issues around UHC staff. UHC staff came to be somewhere in 2020, in April actually of 2020. And you remember this was during COVID, and the norms and standards for the Ministry of Health had been invoked to determine the shortage of health workers. And at that particular time, because of also the pressure of COVID-19 at that particular time, there was need to increase workers. And initially it was envisaged that the country needed around 10,000 healthcare workers that were additional, because what we call health worker density was around 10 per 10,000 people, and then we wanted to increase it to 13, and that needed around 10,000 workers. But because of a lack of budget, it was downscaled to 5,400 workers in the first phase, and then to another 3,000 workers in the second phase. And these workers at that particular time were recruited on the basis of a short-term problem that time, because there was a big clamor to make sure that hospitals are continuing with services as they also respond to COVID-19. And that is how the whole 8,000, actually it was 5,446 and then 3,000. So that was bringing 8,446. But this was done in two phases. And so by August of 2020, most of the workers had been recruited. And the way the recruitment was done was that the Public Service Commission made the advertisements. And after getting the data of all the applicants, and after engagements with the county governments, then they sent that data to the counties, where the data was sieved through by the county public service boards. They identified the workers that they wanted, and they issued them with contracts. So all the contracts of UHC workers have been issued by the county public service boards. And then this data was then transmitted to the Ministry of Health to then pay them a salary. Now, that's really the genesis. And then this happened for 3 years. And at the expiry of the contract in 2023, there was an approval from the Public Service Commission, of course, following engagements between the governors and the national government, the county governments and the national government, through the summit, to extend their contracts by 1 year. And when the contracts were extended by 1 year, by that time, a solution was supposed to be found. But within that 1 year, because of the fiscal space, a solution was not found, and therefore the Public Service Commission issued another advisory that their contracts be extended by a further 2 years, which then ends next year in May. So this is really the journey of that recruitment. Now that has brought two issues which from where we sit in the Ministry of Health, and the Cabinet Secretary has pronounced himself, and we are very clear also with the engagements with the county governments that resources should follow function. And because the contracts have been issued by the county governments, it is only proper that the payroll should also be managed by the county governments. And by a collective decision on the 12th of April, the Council of Governors and the Ministry of Health have now held 3 meetings where we have determined that the best way to move is to move together. And how do we move together? That because the counties are the ones that have issued the contracts, these workers are working at the counties where they are being supervised. The payroll should also be managed at the county level, and so, therefore we are going to transfer that payroll effective 1st of July. 1st
of July. Let's get an understanding, because I think this is part of where the problem is, that the contracts were given by the County Public Service Board. The advertisements were done by the PSC, the Public Service Commission. Where is the payroll? Who pays them? Governor Njuki, do you pay the UHC workers? Where does that money come from? Just so that we get an understanding of that. Do you pay them, or is it the Ministry of Health or the national government that pays the workers?
First and foremost, let me take this opportunity to say congrats to PS.
Thank you.
For being in your first interview and also being appointed the PS. It's a very hot seat. I wish you are the best, and I wish you will stay up to the end, because we would like to solve these problems with you.
Okay.
Your question is a question that has obvious answer, that I believe that everybody knows.
Yeah, no,
if we were paying the staff today, the UHC staff today, we would not be having an issue of who is at work, who is not at work, because it would not allow them to be out of work and still be receiving a salary. The payroll sits with the Ministry of Health, and also the pay is with the Ministry of Health. Of course, where the lacuna is that they are paying people they can't see. They are paying workers they don't know whether they reported to work or not. They are paying workers whether they do not know whether they still report to their working stations, even when they are not on strike. That is the biggest problem. And I want to agree with the PS. I think we, as a government, and I'm looking at one government approach, not county or national government. As a government, I think we may have erred in the way we conceived all of this issue of universal health workers.
Yeah, because why is the payroll here, but you are the one managing it, and health is a devolved function?
First and foremost, they were not put in place only because of COVID. If you remember, that is a time we also had the Big Four agenda, and one of the agenda was universal health coverage, and there was a very big gap, and there was need, and we agree it was the best idea to recruit. It was like RRI, to be able to bring in about 10,000 workers, health workers who are in our cadres, who can be able to bridge the gaps as we roll out universal health coverage, and also because of COVID pressure, be able to take care of that. However, why didn't the MOH in the year 2020 give the county governments funds, even if it was going to be a conditional grant, to be able to manage the payroll? Why keep the payroll in the Ministry of Health and let the universal health workers work in the county and be paid by a different entity? Because it creates that lacuna of
where do they fall?
Where do they fall? Not only where do they fall, are you able to ascertain they worked the previous month? And if you are to exchange those records, it will be taking a lot of time or a lot of effort in between the two departments or the two levels of government in only managing staff. Because health being devolved, all the other staff in the county governments are paid by the counties. Why only 8,751 staff? Why only those ones?
Okay.
So it should have been corrected by ensuring that the counties are with the payroll. The counties also should be having the resources to pay. But even as we prepare, because Oluga says you've had several meetings, which I agree, I wanted to clarify, I confirm, and I'm speaking the Council of Governors position. This is not the opinion of Muthomi Njuki. Whatever I say today is Council of Governors. We had a meeting with the PS and the CS, and it was very convincing, yes, that we need to transfer this payroll to the counties so that we can continue managing them and paying them while we can be able to see them. The last meeting we had with the ministry was on 6th of May between our secretariat and the MOH and also some representatives of the UHC workers. However, it is important to report that when we had the full council meeting for the Council of Governors, this idea was shot down. And
What
the
idea?
county, the idea of transferring the payroll was rejected by the Council of Governors.
Why?
It is because after we spoke, CS and even the PS were in public domain saying they do not have the funds. And that is, it is run by you guys in your media, you've seen it. They do not have the funds to pay the gratuity for these health workers. They also do not have the funds to be able to upskill them to permanent pensionable because they are on a different job group with their colleagues who are not in the scheme that they're in. So based on that, we asked ourselves, how can we be picking payroll and staff with the promise that resources will follow functions, and already they are publicly pronouncing that they cannot be able to give us this money. The money is not there. Where are we supposed to generate the money from? So we had an agreement that we will only receive these payrolls only even when the prerequisite funds have been provided in the equitable share to take care of the pay for these workers. Because these funds are known. Even PSC admits it's about 7.5 billion, around that much, to be able to absorb these workers to permanent and pensionable. But I don't want to say it's permanent and pensionable because different counties have different schemes. There are counties in this country who only contract workers by contract.
So even the promise of permanent and pensionable isn't a promise with
there are the counties that use permanent and pensionable terms. It depends, and it is how you negotiate with the worker.
Okay, so Governor, from what I'm hearing from you, is you're saying you don't want the payroll. In essence, you don't want the UHC workers because the national government doesn't have the money. The national government is saying here that we're going to move this payroll back. Would you understand why the UHC workers are wondering what their fate will be? They seem to be the employees that nobody wants. You don't want them because you say they don't have money. They say they're going to move them to you. So what's their fate?
Can I begin by saying that the UHC workers are very essential. Yeah. We can't do without them. Because today, if you remove 8,571 health workers from the health system of Kenya, especially public, we definitely will have a big problem in providing the same level of service that we have. So we have no issue.
So why the impasse?
So what the reason why we have this back and forth here is lack of resources. If we had the resources, and I want to remind you that resources come from one source in Kenya, one treasury. It does not matter the route it follows. It may follow the equitable share through DORA to county government. It may be an allocation to the Ministry of Health. It can be any other route, but resources come from one kitty, which is taxpayers' money. So we need to agree first and foremost that we cannot do without these workers. But secondly, can we continue having them in the term that they enjoy at the moment, which is basically a term, or rather a scheme of service that is very discriminative compared to their colleagues?
Counterparts in the
that is a problem.
Okay.
And if it was an RRI, did anybody foresee that problem towards the end of the contract? But was it supposed to be renewable? And if it was supposed to be renewable, what terms would this be supposed to be renewed? Okay,
I want us to take a break, but I'd like us to get an understanding of a few things, just really quickly in a few minutes, if we can. They're questioning the fact that they have been on contract, time after time, and not permanent and pensionable, as you said, not on the same terms as their counterparts of the national government. So let me hear from both of you now. Permanent and pensionable, their request for that. Possible? Do you have the money or no?
Let me say two things. One, I think that I am very confident, based on the engagements the Ministry of Health we've had with the Council of Governors, that we will get to an amicable solution. I think it's something that both levels of government appreciate that we must solve, and that's the impression that we have. Meeting with governors, and
that's not the same impression they have.
That's the impression.
Yes, because they're saying, no deal without the money.
I wanted to just talk about the issue of framing, in terms of. I think it's not correct to say that they are the workers no one wants. These are really essential workers, and we have appreciated the contribution that they make for our hospitals, and particularly to the citizens, and we want them to work, but we want them to work in a situation where the law is upheld. We want them to work in a situation where their terms and conditions of work is proper, and we also want them to work in a situation where there is accountability for their presence and for their service. And based on that, I think there is no point of departure. Certainly, of course, what Governor is mentioning, the chair of the committee, is communication that I believe the full council has not yet given to the Ministry of Health. If we had that information, then we would have engaged. But as per the last meeting that we had, which is still the meeting that we made resolutions, we have the understanding that we take the payroll back to the county governments, but also on the understanding that we collectively work on a solution. And we've worked on 3 solutions. One is that the issue, right now it's about the contracts. And remember the resolutions that we both signed, myself and the CEO of Council of Governors signed resolutions. We talked about, after the contracts, we are going to, and based on really the National Treasury, which the chair of the committee has also mentioned, resources come from the National Treasury. Then now we talk about converting those contracts. When you issue the new contracts, then those contracts then become permanent and pensionable contracts. We also talked about...
That's an assurance that you're giving to the UHC workers tonight?
I mentioned that we progressively work with the National Treasury, and that is also based on that approval by Parliament, that will happen. I'm talking about the resolutions that we signed, which is in public domain, that we talked about. We will progressively work with the other stakeholders on that. Number 2 is on the issues around gratuity. You cannot talk about gratuity before your contract expires. And number 3, which is very, very important, that for now we have resources only for the stipend, and we will continue to pay as per the contract until 1st of July, when the payroll will go to the counties.
But the gratuity is, something agreed. In fact, it says those employed under the program are eligible to a gratuity of 31% at the end of the contract period. Is that a guarantee? Because that's also one of the things they've been clamoring about.
That was an advisory from Public Service Commission.
It's gazetted, isn't it?
No, it was an advisory from Public Service Commission. It was an advisory from Public Service Commission.
So you are not committing to the 31% gratuity here?
These are based on availability of resources from the National Treasury, and that is part of what the governors have raised in terms of these resources should also be available.
Okay.
I particularly engaging with the UHC workers and their unions, I particularly do not think that is a bone of contention. I think in terms of priority, first is, of course, the contract itself. I think they would feel like these contracts should be permanent and pensionable, because then that would remove the discrimination at the workplace, where some workers are paid differently from the others.
All right. I really I want to, this question, if you can answer it in just a minute, because I need us to take a break. In all of these meetings, Governor, the 12th of April that we've heard, the 6th of May, has there been representation with the UHC workers?
Yes.
In the meeting of 6th of May, yes, there was representation of workers. Of course, the one of 19, that is a Council of Governors. But after the meeting of 19th of May, I was tasked by the Council of Governors to engage the ministry. And I want to confirm that we had a meeting with the CS on 23rd of May.
Why do you think UHC workers for 96 days have been out on the streets? Because they feel that these conversations are happening at this level without their input.
We have been engaging their union. Absolutely.
So this 96-day strike, where do you place that? Because they obviously feel like they are not being heard.
One thing I'm sure about is that the UHC workers are not looking to be made permanent and pensionable now, but they are looking for a commitment in terms of something penned that says after our term has expired next year,
what happens?
We will get permanent and pensionable.
Exactly.
Number two, they want to be assured they will get their gratuity. And number three, they want to be assured that they will be, in fact, they may not be very keen. From the ones I've heard from, and that is what we need to resolve that, they're not very keen on the payroll being transferred. That is something we need to find out why. They're not very keen on the pay being transferred.
And that's something we will talk about. Perhaps they don't have faith in the county governments. And I will read you some of the comments that they're sending.
That's where they work.
No, but Governor, this is what some of them are saying, that some of them will end up being in the politics of the county and may not be absorbed because county governments often tend to employ other people other than the ones that are needed. It's an issue of trust within the county governments.
I don't think that's a valid reason.
And that payroll will go to the counties because we can no longer hold it illegally.
Well, valid or not, this is how the UHC workers feel, and maybe that is something that you might want to address.
That is a personal opinion by one or two, but I will give you a reason why they should never be worried.
Okay, all right. We will do that after the break. And when we come back, we'll talk about this issue of ghost workers. You say 3,000. We want to know where you got that number from. Where are we? There we are. Let's take a break. When we come back, many questions. And we will now actually start to take the questions from the UHC workers who are watching the program tonight to try and see if we can get their questions answered and their fears allayed. Let's take the break. We will be right back and carry on with the conversation.